1 in 5 OBGYNs have considered leaving the state of Texas. That's according to a new study released this morning about the effect of the state's abortion restrictions. Back in the summer of 2022, Texas made performing an abortion a crime, punishable to life in prison. And doctors say the exceptions to that law remain unclear. This survey also found that more than 70% of practicing OBGYNs feel that the near total ban has impacted their ability to provide high-quality care for their patients. Here to talk more about this is Eleanor Klibanoff. She is the women's health reporter for the Texas Tribune. Eleanor, thank you for being here and for joining us.
Thanks for having me.
Starting off, I want to ask a two-part question. So first, let's start by talking about how the organization conducted this study and what the impacts of the state's abortion laws have been on care.
Right. This was a survey of doctors who are members of the American College of Obstetricians and Gynecologists, sort of the professional organization for OBGYNs. They sent a survey out to all the doctors, all the OBGYNs in Texas, heard back from about 450 of them. And as you said, overwhelmingly, the response was these bans have had a huge impact on the care they feel they're able to provide and sort of the work that they're able to do. Over 70% said that they felt like they were no longer able to provide, the highest quality evidence-based care to their patients. And as you said, many of them are considering or have considered leaving the state as a result.
Those statistics really do jump out at you when you look at these survey findings. But as you dove deeper into them, what do you think stood out about what Texans should be most concerned about in those findings?
Well, I spoke to several OBGYNs who had, contributed to the survey and some who had not. And the overwhelming sense from them was that, this is a problem that will eventually, if, continues the way this survey makes it seem, begin to impact anyone who needs OBGYN care, not just people who maybe have these complicated pregnancies that we're hearing these stories about, but anyone, who needs, routine prenatal care, someone who needs help accessing contraception. Eventually, if our OBGYN workforce gets pushed out, people are leaving, we have these shortages that we're already projected to have, that will begin to impact a much wider swath of healthcare in the state of Texas.
And even zooming back further, in the next decade, it's expected that Texas could have a shortage of OBGYNs. Is the state doing anything in response to that to try to change that?
Well, Texas has been doing a lot over the years to try to shore up what is projected to be a pretty significant workforce shortage on a number of healthcare fronts, including OBGYNs. And they're doing things like building medical schools and building residency programs and incentivizing doctors to stay in Texas. And that has paid off. We've seen doctors stay in Texas. Now, some of the experts I spoke to for this story said Texas may actually be undermining those goals with these abortion bans if, in effect, doctors say, all that is great, I like all that support I'm getting, but I'd rather be in a state where I can practice the full spectrum of reproductive health care.
Very interesting. Well, Eleanor Klibanoff, we appreciate you joining us. I'm a big fan of your reporting, so I'm very happy to have you on the show today to talk more about that. Thanks again.